Due to the graphic nature of this program, viewer discretion is advised.
Get them on IV fluid.
Milwaukee Emergency Center for Animals Television is brought to you by Animal Fairy Charities, a premier organization focusing on animal welfare while teaching compassion to young children.
Well Balanced Dog, your premier canine nosework instructor and trainer.
And Camp Bow Wow, premier doggy day and overnight camps.
So this is Edgar. Edgar is a little guinea pig, probably one of my most favorite little mammals because they're so cute and adorable. They make such wonderful pets for kids. They live between 5 and 7 years. They're not as jumpy as a rabbit is, so they're much less likely to jump out of kids' hands, though I always recommend people to teach them how to hold a guinea pig with a 2-hand hold, one over the back and one over the front end. They're incisors. And then the back teeth are their premolars and molars are continuously growing. So the problem with these guys are we have a lot of teeth problems. They're either genetic or because people don't feed enough hay. So as long as you feed them like 90% hay, and the hay should be Oxbow brand, which is a high quality hay, which you can buy at most pet shops. It's called Oxbow, it's the brand. And it's high fiber. Then 10% of their diet should be dark green leafy vegetables. Anything that's dark green and leafy. About a half a cup of dark green leafy vegetables per pig per night. And then they also have one more requirement, that's vitamin C. They're the only creatures that can't take ascorbic acid and turn it over to vitamin C. They have to have a vitamin C source itself. So they need 1 vitamin C tablet per pig per day. The vitamin C tablets are sold at pet shops, again from Oxbow Company, and every single one needs vitamin C. Some pigs will eat the tablet, some you have to actually crush it up, put it in a syringe and give it directly into their mouth. But they make incredible little pets. And if they have their vitamin C, they have all hay diet, they will be thin, like this guinea pig is, thinner and not big and fat. So vitamin C source, dark green leafy vegetables at nighttime, and then all hay diet, about 90% of the diet, and they make incredibly cute little pets. Coco went into her regular vet last week because she was very sick, not doing well. She was not spayed. They found that she had pyometra, which is a big infected uterus. And so they did the surgery there over at Wauwatosa Veterinary Hospital, did a really incredible job, and very nice, incredible people over there, right? But unfortunately, after the surgery, she brought the dog home, and in the middle of the night, suddenly the dog had some type of an event.
She either seized or not exactly sure what happened. I only stepped away from her for a few minutes after her giving her nightly meds. So I actually went to go get her compress to clean her wound, and within seconds I heard a boom. And when I went in to see what happened, she had fallen between her doggy bed and the wall and was wedged in there. Her eyes were rolling back, and you could clearly tell she was in some sort of pain and couldn't move.
Our feeling is, because she was normal neurologically in every other way, is that perhaps she had thrown a clot and or some kind of embolus to the spinal cord and caused, or to the brain itself, and caused her to be unsteady on her back legs. Now that the days are going by, she's getting better and better. She also, from the surgery, became anemic, because the surgery is a big deal. She's very, very stable now. The only thing is we're trying to get her to eat. And then we're watching the incision site where there's a little bit of an infection there. But all in all, this dog has gone from practically death to now she's come back to life, right? And I think you're amazed at her progress. In fact, I see she's eating all right. Yay!
She did a good
Oh,
job.
that's so exciting. Yay, Coco. Huh? I can't believe it. You ate today. Progressively, slowly, but slowly over the last few days, she's able to get up, and her anemia is improving. So all in all, I think she's going to recover, and I'm very sure she's going to go home tomorrow.
This is Tiny. She is a hamster. She initially presented to the hospital because she had an ear infection in this ear. It was very irritating to her. She was scratching at it, a lot of blood. And so after antibiotics and anti-inflammatories, we found out that she actually had a tumor in her ear. And so we talked about what to do for her in terms of quality of life, and because she kept scratching at it, it was impacting her ability to be a normal, happy hamster. So we went ahead and did surgery, and we removed the tumor. As you can see, the fur has grown back really well, and she's doing excellently. In terms of the environment for hamsters, they're pretty simple, which is great for a first pet, especially once you have a hamster that is as sweet as Tiny is. Makes a great first pet for kids. The environment here does have recycled paper bedding, which is really important to prevent upper respiratory infections, sinusitis, etc. Always important to provide fresh water daily and clean out the cage once a week at a minimum. Tiny in particular gets lots of yummy treats at home. She gets things like pecans, chia seeds, oats, snap peas, and broccoli, and that's a really wonderful variety of food for her. So just because they're very small doesn't mean they can't be taken care of just like your regular cat and dog.
Milwaukee Emergency Center for Animals Television is brought to you by Animal Fairy Charities, a premier organization focusing on animal welfare while teaching compassion to young children through education, experience, and leadership.
Well Balanced Dog, your premier canine nose work instructor and trainer.
And Camp Bow Wow, premier doggy day and overnight camps. And now, a word from our sponsors.
Canine nose work is a dog sport. This new exciting activity for dogs is designed to develop their natural scenting abilities by using their curiosity, desire to hunt, and their love of toys and food. Canine nose work teaches a dog to use their nose to find a specific scent and then tell you they found it. It's like watching a police dog work, but it's your dog having the fun. Any dog can do it, and they build confidence and solve problems, all while burning lots of mental and physical energy. Get your dog involved. Call Well Balanced Dog or visit dogwellbalanced.com.
For over a decade, Fetch magazine has examined the unique bond humans have with their canine companions by publishing popular dog-related topics. With a strong commitment to dogs in need, Fetch also prints local adoptables in each issue, supplies affordable advertising to businesses, and gives rescues 30% off of ads. This year, Fetch is offering $15 subscriptions for your convenience. For more information, visit www.fetchmag.com or pick up your free copy at a local pet establishment near you. Go Fetch!
Boarding, grooming, training, and more. When it comes to your pet, Animal Motel is their home away from home. At Animal Motel, we offer a top-of-the-line facility with boarding suites for both dogs and cats, outdoor play yards, a training hall, and so much more. Whether they're here for obedience training, grooming, or an extended stay, we promise your dog and cat will be part of our family. Animal Motel, personalized care for your precious pets.
Tico is actually about an 11-week-old little puppy that presented here really sick and down out. The owners couldn't take care of him any further, so they opted to surrender him to the hospital. He was adopted by me as our second mascot, Packer being the primary mascot. Right now they're getting to know each other, but they're not the best of friends. Tico thinks that life is great, but Packer doesn't think it's so great, right? So this is going to be the new mascot of Mecca now.
So we have a 7-month-old male intact dog. He presented for a history of vomiting 6 to 8 times within the past 24 hours. Yesterday it was just food and water, and then today it got really dark brown, very, very smelly, smelled a little bit like feces. So the owners were very concerned about what was possibly going on. There are 3 young children at home, and there's always a possibility for toys or socks. Apparently our puppy here does like socks, and so the concern was for something like an obstruction. So he took some x-rays to see the pattern of the intestines that were showing, as well as some blood work to see if there were any metabolic or electrolyte derangements. And what we found on x-rays was that there was some gas in the stomach and there was something in the stomach, but again, it didn't scream obstruction to us. And then the blood work again was mostly normal, but again, starting to veer off abnormally. And so rather than wait and have this dog, continue to worsen with clinical signs, the owners were great and decided to hospitalize, and we're doing a barium study right now. It's a really great way to assess for obstruction before surgery. He's not a big fan of it, but he's being a very good boy for it.
No, don't spit.
Shaggy is a 14-year-old male neutered doggy, Cocker Spaniel, that just came in today because the owner noticed that there was bleeding from the back end. So they had noticed that there was a mass or like a little tumor on the back end of the dog, but it was very small. And then it started increasing in size a little bit. And they had brought the dog in here a few months ago, and we had actually taken a sample of it, sent it into the lab, and found out it was just a benign mass. So at that time we chose not to do anything, kind of based on the age of the dog too, and it wasn't really bothering him, it wasn't bleeding, and it was pretty small size. Now they woke up this morning and they found a lot of blood in the house.
We don't know, the seriousness of it with the bleeding. Naturally, when you see bleeding, you assume that it needs to be taken care of. So we didn't want to wait and let it go, or try and bandage, or try and put any type of ointment on ourselves with gauze. We thought best come in and have somebody that knows what they're doing look at it instead of two amateurs.
I checked the dog over, and I mean, he looks good. He's very healthy for a 14-year-old dog. A 14-year-old dog is actually like about probably an 85-year-old person. So, like his owner, yeah, exactly. You see how old he is? No. So when we look back here, I mean, he's good weight. He's good every other way. He's got a mass right here, just below the anal area. Our concern is that once that opens up and it starts bleeding, I mean, they could actually gush out blood and hemorrhage and bleed to death. So we're gonna have to take it off. We have no other choice at this fact. I mean, we would love to say, well, let's just keep it there. The dog may, in a year or 2 years, life expectancy is over for this breed. But unfortunately, this is bleeding now. We're going to have to take it off. So I'm going to set up a surgery day for them. We're going to get some blood work to make sure he's healthy enough to take it off. And then we're going to put him on antibiotics in the meantime so that closes back up and stops bleeding.
Stay safe.
Dear. Oh, little good boy.
So who is this?
So this is Shiloh. He is a 7-year-old male neutered husky who presented from Illinois today for a 4-month history of pneumonia that's unresponsive to antibiotics.
It happened a few months back, and we had taken him to a vet locally by us in Illinois, but after months of medication, there was really little to no improvement, so we had to take a further step and take him to a more, specialized place.
They've had him on a 6 to 8 week course of antibiotics, and he's not responding at this point. He's still eating, but obviously has exercise intolerance and can't really do anything but sleep. It's the only time that he breathes normally.
So when he gets up, he starts breathing.
Yeah, like this. Anytime he gets excited, anytime he moves around, this is basically what he does. Very harsh lung sounds on both sides. So I'm thinking that we'll take some x-rays, we'll probably take some urine.
And how old is he?
He's 7 years old. And take some urine for a blastomycosis test, which is a fungal agent that we find a lot in hot spots around Wisconsin, in Illinois, up here in the Midwest. We definitely have it here. So oftentimes when we have any sort of pneumonia that's unresponsive to antibiotics, we start to question that, especially when it's a severe pneumonia, that may be the pathogen that's causing the pneumonia. So oftentimes we test for it, and if it's positive, then we have to keep them on antifungals for sometimes up to several months before we can take care of the pneumonia. But we'll run some blood work as well and see what that tells us and go from there.
Of course, we can't say it's not cancer, but we're going to kind of put that lower on our list when you have a 6-7-year-old dog. And in the area they're coming from, again, like she said, not responsive to antibiotics now. And being this drastic, we're thinking something like blasto is probably should be on the top of our list. Something very treatable, but if you don't get to it quickly and get the drug started to get this under control, you can lose the patient in the meantime. So we got to get very, very aggressive very quickly here. We did find kind of a mass area in the neck area of the dog. So we shaved it and we found an area of, there's an enlarged mass right in this area right here. This is in the thyroid area of the dog. Our thyroids are right here, right behind our neck, our thyroid gland. Thyroid has a lot to regulate your growth and different things in your body, metabolism in your body. If a tumor grows on it, it usually is a thyroid carcinoma. So we put a needle in there and we got a sample and we're going to send that off to the lab. We're also taking a sample. We sedated him because he was so struggling to breathe when he was moving around a lot, and just to help us get all of our diagnostics, we gave him a mild sedation, so just to kind of settle him down. And then we're going to send off a urine sample, which I'm going to get here, and send for a blastomycosis, which is a fungal infection, and then I'm going to go over and show you the radiographs. What we did was we took a radiograph of the chest cavity. So what we want is a lateral. We took two views, one the right side of the chest and then the left side of the chest. And then a VD, which is a ventral dorsal view, which is Shiloh on his back. And the heart is in the center. And the lungs are surrounding the heart. And we've got some white areas here that you see that we're a little bit worried about. And then a lot of little white areas here, speckled areas of whiteness here that show that there are pulmonary infiltrates into the chest cavity itself. And there's a little swelling around the neck. And again, that's where the thyroid gland likes to live, right there. So we're a little concerned that this could be, instead of blasto, a fungal infection. We're a little concerned that this is a possibility to be some kind of a tumor. We are sending the radiographs out to the UW right now, and we're sending them out stat so we can get the analysis back right away. And then what we'll do today with Shiloh is keep him in the hospital on IVs and on oxygen until we get every one of our diagnostic tests back, so that we can help the owner decide what is the next step.
Hi, I'm Jonathan Lucroy, professional baseball player. I'd like to thank Mecca, Dr. Lichtenberger for taking care of my dog Dash and helping him out with some immunization stuff. I'm honored to get such good medical care, and I'm proud to be part of the Mecca TV show.
So we see all kinds of animals here. What do we see, Michael?
We see lizards and snakes and dogs and cats and chickens and guinea pigs and rabbits.
And pigs. We've seen pigs here. Yeah, we see all kind of creatures. And what did you guys bring?
I brought blankets.
Wow.
Pillow.
Oh, good. The dogs will love it.
I would love
so
that.
much.
I would not because it's covered with dog pee.
Oh, that's so nice, you guys.
Right here.
Aren't you happy, Mike?
Yeah,
that we have
great.
so many
Yes, we need it.
special beds because
Yes.
all the animals are so sick.
So we've got surgeries to see, guys. Yeah, a real life surgery that's going on. A lot of sick patients, okay?
Today's show was brought to you by Animal Fairy Charities, a premier organization focusing on animal welfare while teaching compassion to young children. For Pet's Sake Dog Training, Bichon and Little Buddies Rescue, and Camp Bow Wow, premier doggy day and overnight camps.